Angie McCall, and this is my persuasive speech. We've all seen on the news from time to time where a mass shooting has occurred and later determined that it was by someone who had been suffering from a mental illness. This is where our mental health system has failed us by lack of resources available to the people in need. According to NAMI.org, 1 in 5 adults experience a mental illness every year. Nearly 60% of them will not receive the services they need. Today I'm going to discuss the lack of resources we have for the people suffering in my community. On June 30th, 2015, the Mount Pleasant Mental Health Institute closed its doors, forcing people to go elsewhere for treatment. The Mount Pleasant Mental Health Institute opened in February 1861. As I researched this on Wikipedia.com a little bit further, I found that they reached their peak of 1,581 patients in 1946. In the year 1945, new therapies and medications had helped lower the facility's population, and the average length of stay was reduced from years to a matter of weeks. In 2015, Governor Terry Branstad announced the closing of the Mount Pleasant facility. Despite Iowa's concern that more inpatient beds were needed, his decision was immovable. This sent the community into an uproar. People were losing jobs, and the people were forced to find help and go elsewhere. And at that time, there were only 2 facilities left in the state of Iowa, those being in Cherokee and Independence, which are still open today. Currently, there's 723 beds in the state of Iowa in local hospitals and regional hospitals, and this diagram shows the closings in the state of Iowa. So there's not that many. To give you a little insight on how much the state of Iowa is in need, this information is researched from NAMI.org. There are 2 state beds per 100,000 residents compared to the national average of 12. That's quite a difference in my opinion. Those in need are forced to go to the emergency room and wait hours, days, and sometimes weeks for an open bed. Historically, you have the likelihood of winning the lottery than finding a psych bed in the state of Iowa, especially on the weekends. Hospital staff struggle to find placement for patients, and they sometimes are released to find their help on their own and find what's available for them, and oftentimes they're left untreated. In my community, adults are sent to outpatient facilities, and they are closing every day due to funding. The lack of mental health providers is low. The U.S. spends more on treating mental health than they do other conditions such as heart conditions, cancer, and diabetes. Each year, mental health services cost our economy $193 billion, and currently in lost wages and productivity. Iowa ranks last in the country in providing mental health beds. They also have fewer mental health professionals in almost every state in the nation. So what can we do? A solution would be, according to IHA Online, we can increase the number of crisis homes, provide stable services, and possibly investigate a telehealth service which provides a mental health physician to examine a patient through a mobile computer device. During that time, the doctor can examine the patient and make sure he has the right diagnosis. During a mental health crisis, going to an emergency room is sometimes your only place to turn for help. That situation has changed in the small Iowa community of Centerville. Thanks to a broad coalition of community partners and a local hospital, they found a way to improve mental health access. They opened a home to those in need called Oak Place. It helps locals with mental health care. It provides mental health care close to home. If more communities, including my own, would organize something like this, it would be a great resource for those in need. So as I wrap things up, we all know that the lack of resources for mental health needs improvement, and it's an ongoing process to get the resources to Iowans. I know people that have struggled with mental illness, and they were fortunate to find the resources, but for some, it's not that easy, and we need to make their way a little brighter and give them the help they need. Thank you.